So did you know that 3 out of 4 children will develop crooked teeth and they require braces? As parents, even at an early age, we may notice our children teeth and jaw structure, it may just not be developing ideally.
The traditional orthodontic advice has been to wait until all the child's permanent teeth are coming in, only to be faced with the possibility of extractions, surgery, and then years of braces. But NEO, New Early Orthodontics in Lone Tree, is setting a higher standard for the way orthodontics is performed with an integrative approach. So joining us today, we have Dr. Kent Lauson, the orthodontist at NEO, and also he's a best-selling author. And then we have Jacquie Palisi, a mom of 2 patients at NEO, twin boys, right?
That's right.
How fun. So welcome to you both. We appreciate you being here.
Thank you.
So,
Thank you. Nice
Dr.
to be
Lauson,
here.
what does it mean to be an integrative orthodontic clinic?
Well, traditionally, orthodontics has been involved with straightening teeth, and that is basically all orthodontists have looked at for many, many decades. But recently, we're thinking more about the whole body, the effect on the whole body. So being an integrative orthodontist means that we look at the whole body. We look at things like airway. We look at things like head posture even. The way the teeth fit together affect head posture. Can affect things like TMJ dysfunction. Can affect a lot of different things, even later on having obstructive sleep apnea.
And what are the long-term health consequences associated with some of the issues that you did just mention? And are these preventable at an early age?
Well, they're very preventable at an early age. If we start seeing patients as early as age 3 and 4 with this approach. And they're very preventable if we know the right things to teach that child. They learn new habits, breathing through the nose, tongue in the roof of the mouth and rest, proper swallowing. All those types of things can be learned at an early age. But the long-term consequences can be very severe. As I mentioned, TMJ dysfunction, potentially jaw joint issues. Obstructive sleep apnea is a big one, because later on when that child that might have even had some permanent teeth removed during that time could develop a condition called obstructive sleep apnea.
Wow.
That's snoring and leading to literally choking at night.
Scary,
Yeah.
scary. Well, let's take a look at some of the befores and afters of some of your young patients and just see the difference that you've been able to make. Kind of walk us through this, if you would. This is incredible.
You bet. Well, this patient had a thumb-sucking habit, and you can see a very narrow upper jaw. And after a few months of wearing what we call a myobrace and working with the habits, we were able to achieve the result that you see here. Now, that's far from the time that all the permanent teeth would be in, so we're talking about a 24-month period wearing a myobrace and getting that type of change. Without braces, it's just a strictly at nighttime appliance. And then this patient had several consultations. She was 12 years old, and everybody told her that she was going to need surgery. Well, the dramatic result that you'd see, the difference, was with 25 months of myobrace, 7 months of braces, and this really changed radically her ability to breathe through her nose, and you could see the beautiful facial structure. Avoiding braces completely or extraction of permanent teeth, you know, it's really a beautiful thing when we see this develop like that.
Gorgeous.
Okay, and this one really shows the change of a dental arch form that can occur over a couple-year period wearing just this nighttime appliance. This patient was destined to have a fair amount of crowding and overbite. They now end up with this nice, wide, full arch form. It increases their airway, ability to breathe through their nose. This is really a big deal for them.
Yeah.
Changes life.
These pictures are so dramatic. Why wouldn't every parent want this for their child?
Well, they should. We think all parents should come to our office. But there's a lot of misinformation out there and not a lot of understanding about what we can do at that very early age. Because traditionally, orthodontists have waited till maybe age 11 or 12 and then full set of braces.
Yeah. Jacquie, if you would kind of share a little bit about your experience with your twin boys.
Absolutely.
And their experience at NEO.
Well, they're very different, and so they have different face structure and everything. But I had one kiddo who had kind of that snaggle tooth, you know, that tooth that's coming out of the top of his gum and thinking, okay, braces, braces. Dr. Lauson, I knew, did this really great integrative approach, and one of the things he's been talking about is this MyoBrace, and I brought it. This is directly from my son's desk, and it's this rubber appliance that he's been wearing at night for the last year, and it has straightened out his teeth, and not only straightened them out, widened his smile, it's taught him how to breathe properly with his mouth closed and his tongue in the proper position. And this is the before and after, where you can see that snaggletooth that's just sort of up there. Then down below, this is just, well, I think just a couple of weeks ago.
Right into place.
They fall right into place, and he has this great smile now with no issues whatsoever as far as sleeping and sounding like Darth Vader when he's snoring, because he knows how to breathe properly. And it's brought his chin forward, so his chin isn't quite as recessed, but we're just loving his beautiful smile without the braces initially, using this MyoBrace appliance just at night and an hour during the day.
Incredible. Well, thank you so much for sharing this new information. It's really exciting, and I know you have a wonderful offer for our viewers, because your child's overall health and smile is so important. NEO is conveniently located at the Lincoln Light Rail Station just south of Park Meadows Shopping Center. Call today for your free consultation and mention Colorado's Best and get $600 off any treatment. In addition, parents will receive a free teeth whitening session at NEO, so visit their website. It's neo-smiles.com for more information, and you can also give them a call, 303-690-0400. Please call them today. 303-690-0400. Please call them today.
Well, are you getting